One of the most important tests that you'll take on yourself, that the doctor won't give you, is to take your pH. You can take the pH two ways, either your urine's pH and your saliva pH. pH is a measure of acidity or alkalinity. Everything in the body is pH sensitive. If you get too acid, not only will your body begin to start breaking down, but your oxygen levels go down, your energy levels go down, hormones, enzymes, everything starts becoming out of whack. Cancer patients are very acidic, tend to be very acidic, which is the same thing as saying they're starving for oxygen. We already talked about slowing the breathing down as a way of increasing oxygen. But taking something as simple as baking soda, sodium bicarbonate, or even more preferably sodium bicarbonate and potassium bicarbonate. What the body struggles to produce enough bicarbonate every day. The stomach produces bicarbonate to neutralize the stomach acid. The pancreas produces bicarbonate, so when the acidic food comes out of the stomach, it neutralizes the food. And the kidneys, of course, produce a lot of sodium bicarbonate to try to keep the blood stable. As we get older, our bodies become more bicarbonate deficient. Is another way of saying more acidic. Cancer patients, of course, are very acidic. Taking baking soda is a way of instantly neutralizing that acid. Taking baking soda is actually a main treatment, an important treatment for cancer. Athletes understand that when they take baking soda, they have more endurance because they have more oxygen. Things are moving better, every physiological process, when we're more alkaline. Alkaline tissues hold more oxygen. So taking your pH, which is simple as getting a pH paper like this. This is a really good type of paper because it reads from 5.5 to 8. A lot of pH paper goes from 1 to 14, but that's not for humans, basically. So you just, in the morning, if you're doing pH medicine or pH therapy, say you're treating cancer or another serious disease, you take enough bicarbonate to get your urinary pH up to 8. You need to measure that, especially if you're a cancer patient, you need to measure that in the morning, in the first urine, it should be 8, in the afternoon and in the evening. And you do that for like 10 days, and then you either stop or vastly decrease the bicarbonate, see what happens to your pH, and then you can do it again. Saliva pH is put the paper in your mouth, hold it for 10 seconds, and then you just match the color up. I'm sitting here about 6.8. I'm taking bicarbonate, and I could take some more. Because I drink a lot of coffee, so I tend to be slightly acidic. One of the nicest formulas and easiest ways of taking bicarbonate is in a bath. You can load baths up with 1, 2, 3, 4 pounds of baking soda and put in equal amount of salt, like Dead Sea salt or magnesium bath flakes or Dead Sea salt. Wonderful way. And I have recently had a friend formulate this product. It's called pH Adjust. It is sodium bicarbonate, potassium bicarbonate, and magnesium carbonate. So you can get your bicarbonates in two forms, so it lowers the amount of salt you're getting. You're getting the magnesium, and you're getting a easy to drink formula. So being able to get your magnesium bicarbonate and potassium in an easily drinkable form is wonderful. It really is wonderful. pH perfectly tracks cell voltage, tissue voltage, and oxygen levels. It is a key determinant of health. Easy to diagnose and reasonably easy, or actually very easy to treat. So for cancer patients, this is crucial information because cancer, by many or most people's definition, is a low oxygen situation. For healthy people, it's still good to take some bicarbonate. Most people take bicarbonate for stomach ache after eating to neutralize excess acid that's coming back up into the esophagus. But before meals, even healthy people should be monitoring their pH levels and take 1 or maybe 2 dosages of bicarbonate or this pH adjust formula a day. And this applies more and more to when people get older. And for children, besides iodine, bicarbonate is a wonderful medicine when they're getting sick or getting a bad flu. Bringing bicarbonate into the body, opening up the blood vessels, receiving more oxygen is a very good thing to do. So make friends with bicarbonate. It is a wonderful medicine, though it is incredibly inexpensive and, of course, very safe.